This is an example of poor professional boundaries. Polly is a 28-year-old home health aide with 2 children. Bess, a 90-year-old widow, is one of Polly's patients. Polly is going through a divorce and seems to be on an emotional roller coaster lately. Polly feels better when she can talk about her situation. Recently, she has begun to share her experiences with Bess, including details of her ex-husband's infidelity, his failure to pay child support, her dire financial situation, and her children's unhappiness. Bess seems to be a sympathetic ear for Polly and listens attentively when Polly shares her experiences. So what issues potentially could there be in this situation? The first thing we need to consider is this potentially financial abuse? Is this a safeguarding issue? Is Polly sharing the information with Bess about her financial situation as a means of inciting some sort of payment for her? Is she trying to make Bess feel bad and actually give her some money? If she is, this is a clear safeguarding issue and needs to be reported following your organisation's safeguarding policies. Second issue we need to consider is this is an inappropriate environment. It's an inappropriate environment for Polly to be sharing this information in. Polly is there to provide care and support for Bess, not the other way around. If Polly does need to talk about her circumstances and the issues going on in her life at the moment, then she needs to find a better environment. Maybe talk to a friend, a family member, or maybe take her concerns to her manager to see if anything can be sorted out. It also makes it an inappropriate environment for Bess. Are Bess's needs being taken account of? Is she actually getting support in this time, or is she just being used as a sympathetic ear for the carer? The third issue we need to look at is potential trigger warnings. Do we know enough about Bess's life? Do we know about her past experiences? Do we know that the things that Polly is talking about will not trigger some bad memories in Bess? She talks about her husband's infidelity. Do we know if Bess's husband was unfaithful when they were married? We need to be careful about what we talk to our service users about, because it can cause this sort of issue. Next issue we need to look at is oversharing. We talk in care a lot about you building good, open, trusting relationships with the people you support. They have to have that faith in you. They have to have that trust in you that you are going to be able to support them. So sometimes you will have to share some information. If Bess was to ask Polly, was she married? Then Polly can say she was married, but now she's separated from her ex-husband. She doesn't need to go into the detail that she goes into. We also need to consider whether she needs to share information about her children. It can be difficult when somebody you support asks you a direct question, such as, do you have children? You can't say, I'm sorry, that's none of your business. That's rude. That's going to hamper that relationship building between you and the person you support. But she can share the fact she does have children. Yes, I have 2 children. Potentially she can share their names as well. I have a boy called Peter, a girl called Mary. But that's as far as it needs to go. She doesn't need to share the dates of birth and information like that. The next thing we need to look at is, when does Bess get listened to herself? Does she actually get time to talk about what's worrying her? Does she get time to talk about her issues? Bess might be having a really, really bad day on that day. It might be the anniversary of her ex-husband's death. It might be the birthday of a child she hasn't seen for many years. But she doesn't get the chance to talk about how she's feeling because she's too busy listening to Polly sharing her worries and her situation. So we need to make sure that the people we support are the focus of that call and they get the time to talk about what they need to talk about. So it can be seen quite clearly that professional boundaries are being crossed right the way through this scenario. Polly is not paying attention to the basic rules. We talk in care about it's important to remember that you are a friendly professional. You're not a professional friend. Yeah, you're not being paid to be that person's friend. You're there to support that person.